Thank you, Senator. May I now call on Senator Bayh for his questions.
Thank you for being with us today, Mr. Chairman. I'd like to follow up on Senator Hutchinson's question. I realize that you haven't had a chance to review the OMB analysis of some of the different proposals that have come up here, but just let me ask you in general, if we enacted a health care reform proposal that did not bend the curve, that wouldn't really meet the long-term fiscal challenges that we're facing, in your opinion, would it?
If it did not, it would not. If it did not address the cost issue, it would not meet the challenges.
So in some ways, the test that's being applied around here, they're looking at health care in isolation rather than as a part of the broader fiscal picture. My concern is that the long-term fiscal policies that we're on now are unsustainable. I know you're concerned about the increasing debt of more than 2% per year. Some people would say it really can't increase more than the annual rate of GDP growth. If you look at this 5-year budget and the likely 5 years after that, in no year will the growth of the debt be really below 3, and in many years it will be substantially beyond that. So as you know, it takes on a multiplier effect, and if we don't come to grips with this, it really is going to get away from us. So if all we did was even pass a health care bill that was deficit neutral, didn't make things worse but didn't make it better fiscally over the next 10 years, that really doesn't get to the heart of the problem either, does it?
That's correct.
So in some ways, I think the standard we're holding ourselves to from a fiscal point of view is inadequate. And when at least the initial analysis of a couple of the proposals suggested it might actually exacerbate the situation, well, that is a matter of some concern. I know the President cares about that too, and now they're looking at things that really can bend the curve, hopefully, because it's just not sustainable, the financial path that we are on. Let me ask you about the revenue side of this. You've been an observer of the elected branches of government for a fair amount of time, as have I. The path of least resistance here is to claim savings in some sort of out years that may never materialize, or to pretend to impose cost reductions that the Congress never has the backbone to actually enforce. There are about 18 different things that were proposed to bend the curve. 16 of them have been included, but they're largely pilots or small demonstration projects. They don't really get up to scale over the next 10 years in a way that's going to make a material impact on the deficits. If you were sitting where we're sitting, how do we, and the OMB is reluctant to score these things because they're just so amorphous and so long-term, it defies, reliable analysis. What do you do if you're a policymaker in a case like that?
Well, you first judge to see if you have approaches which you think are sufficiently well documented that you think they would be reliable, and if so, you can score them. If not, you might put in triggers of various kinds that say, we will limit the growth unless we show that we can reduce cost per person by so much percent. So there might be ways to tie the expansion of the program to the success of cost-saving measures.
Well, that would certainly be a good thing. Again, the difficulty is that some of these things have been, some companies have implemented some of them, and they've worked on sort of a micro level, but they've never been done at scale, and so that they're not included in the proposal at scale. So the OMB says, look, intuitively, it makes some sense, but if you're asking us to put our reputation on the line with a hard score, just can't do it. And as you know, it's difficult to estimate things a year or two in advance, let alone 10. So a lot of this is just educated guesswork, and that's well, it's a difficult platform upon which to build long-term fiscal policy. And so that's one of the things that we're struggling with now. One of the proposals that had been suggested was to take, and here, as you're aware, there was some time ago an agreement made to reduce Medicare reimbursements for physicians. We always waive it every year. And so now there are further savings in a variety of programs that have been pledged as a part of this program. One has to look with some skepticism about whether we'll actually enforce them. So to kind of take the politics out of it, to maximize the chances that the savings will actually be achieved, there's a proposal to create an independent commission outside of Congress to set Medicare reimbursement rates. Do you have an opinion about that from a fiscal policy standpoint?
Well, I think that's ultimately up to Congress, but you have seen examples like base closing commissions, things of that sort, which have tried to make a technical decision, and then Congress has had to vote it up or down. So that maybe something like that would be promising. I guess I would note that things like reducing compensation to doctors can give you one-off savings, but you've also got to deal with just this ongoing growth rate, and that ties into the structure of our healthcare delivery system. Right. And so the question you have to address is, are we, for example, overusing technology?
We need systemic reform, not just one-off
That's right.
savings.
That's right.
We may have some of both. But you're right, in the long run, the rifle shots won't get this done. I'm having some cognitive dissonance, Chairman. One of the things in the stimulus package we enacted was some reduction in payroll taxes for most Americans to try and put some money in their pocket to buck up consumption. One of the proposals that's out there dealing with the employer mandate arena is to require employers below a certain size or above a certain size that don't participate to pay up to 8%, higher payroll taxes as their contribution to health care. How do we reconcile these two things? We'd be cutting payroll taxes on the one hand to stimulate the economy, but possibly then raising them up to 8% on small and medium-sized businesses that don't contribute to health care on the other. Do you have a reaction to that?
Well, in the short run, raising taxes in a recession will tend to weaken the economy. So that there is no inconsistency there. I think the issue is if you're going to have additional coverage, how are you going to finance that? And I assume that this proposal would be a way of financing that in the longer term. It's more of a long-term proposition. And in terms of the economy, maybe if you're doing that, you might want to consider phasing it in slowly, or so that it doesn't have an immediate impact on the profitability of small business or on the demand of consumers.
That's true. It's a short-term, long-term phenomenon, but as you know, businesses tend to make investment decisions and even hiring decisions with an eye toward the intermediate term and even the longer term, not just
That's true.
The circumstances that they face today. So in some senses, we're trying to accomplish a humanitarian thing here, which is right, and make systemic reform, but reconcile that with the budget situation that we face and the need to not add burdens to the economy at a time when, as you pointed out in your testimony, it's burdened enough. I just want to conclude by thanking you. I really appreciate your emphasis on the importance of fiscal policy. Your comments today reflected your op-ed piece in the Wall Street Journal. The hardest decision in this town over the next couple of years is going to be how do you go about altering the very accommodative policies that we're now pursuing, both monetarily and fiscally. It's going to take the wisdom of Solomon. I wish you the best with that, but I think we've got a good man in a position to do that. So I appreciate your appearance here today.